Good morning, everybody. Let's discuss some more questions and let's see if we can be well prepared for the ARDMS registry examination, especially for the SPI sonographic principles and instrumentation. Let me share the screen with you guys and just be with me. Let me share the screen and discuss a few more questions. Okay, so here are the questions. The question is, it says the term when piezoelectric material change shape while voltage applied to them is called what of the following? When electricity touch the crystal, what happens and what it's called? What is that specific name for that? Is it piezoelectric effect? Is it reverse piezoelectric effect? Is it reflection? Is it apodization? Or is it all of the above? What do you think? Yes, I'm also agree. B is the correct answer. It's called reverse piezoelectric effect. Correct. Okay, let's see the next question. It says, ultron transducers are the devices which convert electrical energy into sound energy and vice versa, sound energy to electric energy. What do you think? Is this true or false? Actually, I made it for options, but basically the question is true and false. Is it true or false? Yes, of course. Clearly, it's a true. Of course, that's what the transducer is. That's the definition of transducer. Okay, let's do the next question. It says that backing material in an ultrasound transducer is also called. Like, what is the alternative or other name for the backing material in a probe or transducer? Is it crystals? Is it active element? Is it damping material? Is it matching layer? Is it none of the above? Yes, C is the correct answer. Damping material and backing material are the same. It's the same metal powder which make the electricity and pulses. Correct. Okay, next. It says without backing material, or of course damping material, the PZT, lead zirconium titanate or crystal, well, it's just a bracket. What do you think? Which word will suitable to be here when excited by applying the voltage or a voltage? So A, no ringing at all, ringing for long time, less ringing time, stop ringing, or all of the above. If there is no damping material, no backing material in a transducer, what do you think? Which of these options will be more better or suitable or more make sense to put it here? What do you think? Exactly, A is the correct answer. So, I'm so sorry. I was just kidding, guys. Ringing for long time. B is the correct answer. So, if there are no backing material, the crystal will be continuously vibrating, will be making noise continuously without break, actually. So, B is the correct answer. Absolutely correct. Okay. Next question. It says, without backing material, the PZ3 crystal will generate. Almost the same question, but the concept is the same. But let's see which option you think you can choose, which will be the best option. Without backing material, the PZT crystal will generate what? Long pulse, short pulse, no pulse at all, or all of the above. Which one is the correct answer? With no backing material or damping material. Exactly. That will be a long pulse. Continuously, the electricity will come and will hit the crystal and will continuously vibrate and make a long pulse with uncountable cycles, we can say. So, long pulse. That is the correct answer. Let's do the next one. Okay, so the next question is, which of the following resolutions are improved with the short pulses? If the pulse generated very short, either it's a shorter SPL or either it's a less cycles, but it's a very short pulses. What do you think? Which of the following resolution can be improved with that or get better with that? Is it lateral resolution, axial resolution, contrast resolution, temporal resolution, or elevational resolution? What do you think? Yes, of course. Very clear and simple. Axial resolution. B is the correct answer because axial resolution determined by SPL. That is absolutely correct. Okay. All of the following are the advantages of backing material and ultrasound transducer, but except what? There are 5 answers. 4 answers are correct, but one answer is not matching. Find that one. What do you think? if like when there are backing material or damping material in a transducer, so these are the advantage of them. Sometimes there is something which is disadvantage, which is not matching. Shorten the pulse duration, axial, improve the axial resolution, improve the lateral resolution, shorten axial pulse length, producing image. Which one is not matching? Exactly. Lateral resolution has no relationship with the backing material. So lateral resolution, C, is the correct answer to be chosen, but that's not advantage of the backing material in a transducer. Correct. Next. The next question is, all of the following are the advantages of backing material in a transducer except. Again, same question, but with a different answers. Decrease transducer sensitivity, decrease bandwidth, decrease efficiency, and increase the bandwidth. What do you think? Which of the following is the disadvantage of backing material? Not advantage, disadvantage. Okay, exactly. B is the correct answer to be chosen because decrease the bandwidth. No, when there are a lot of backing material, when we have a backing material in our transducer, it will actually wide. That will make it wider bandwidth. So that's why that's the disadvantage of them. So decrease the bandwidth is the answer to be chosen because when we have, that's the advantage, that to have a bandwidth is increased or wider bandwidth when there is backing material. But this will also, we can say, this says decrease the bandwidth. No, increase and decrease efficiency and decrease the transducer sensitivity are the correct one. But B is the answer which is not matching to the disadvantages, actually. Correct? So this is the correct to be chosen. It says decrease the bandwidth. The following are the disadvantage of the backing material. This is the disadvantage of the, this one, correct. Okay, let me share the screen one more time and let's proceed to more questions. Okay, so here are the questions. Let's do the next question. The next question is actually asking for same transducers. So it says all of the following transducers are using backing material except these options. These transducers, they have the backing material, damping material, and their structure. But there is one probe among them which is not using damping material. Choose the one. Which one is that? Is it phase array transducer? Is it linear sequential array transducer? Is it PDF probe? Is it a vector probe? Is it convex probe? What do you think? Which one is the correct answer? Think about it. Yes, C is the correct answer. PDF probe is not using the damping material, backing material. It's a bland modality. It's for the velocity we use. That is a specific probe for the continuous wave ultrasound. Absolutely correct. All right, next question. More damping material in an ultrasound will affect which of the following? What do you think? If there are more damping material, more backing material in a transducer placed, so what do you think? What will happen to this ultrasound? So let's see. Will produce more cycles in a pulse? Will decrease the number of cycles in a pulse? Will produce narrow bandwidth? Will produce a longer SPL, special pulse length, or all of the above? What do you think? Which one is the correct answer? Yes, that is correct. B is the correct answer. Will decrease the, because if we put more damping material in a transducer, it will decrease the number of cycles and a pulse. It will make the pulse more shorter, very shorter. Correct. Absolutely correct. Let's do the next one. Okay, good job. Okay, this question is asking, from the following transducers, which one will have a shorter SPL? Special pulse length. Let's see. Let me give you these options. It's 12 megahertz, 7 megahertz, 5 megahertz, 2.5 megahertz, or none of them. What do you think? Which one is the best option to be chosen? Exactly, simple and clear. 12 megahertz. The higher the frequency, the shorter the SPL. Absolutely correct answer is the correct. Let's do the next one. Okay, it says if we measure propagation speed of an element or crystal, to be 6 millimeter in a microsecond, and the thickness of crystal is 0.6 millimeter. Now calculate the frequency for this transducer. Now it's a little bit, it's not a tough question, but the thing is, you should know the formula, correct? To calculate, to have the solution for this question. Okay, I will give you the options. 6 megahertz, 3.6 megahertz, 5 megahertz, 10 megahertz. What do you think? Which one is the correct option? Exactly, C is the correct answer. 5 megahertz. Why? Because we have a formula, if you remember, it says propagation speed of the sound in the crystal divided by 2 times the thickness of the crystal. So here, 6 millimeter divided by 2 times the 0.6, and that will be, I believe, so 1.2. So 6 divided by 1.2, and answer will be 5 megahertz. Absolutely correct. Let's do the next one. Which of the following is Curie point and sonography? Okay, Curie point, as you know, it's a heat where the PZT, lead zirconium titanate, or the crystal, they will destroy, they will be not having that effect to convert the electricity to the sound and sound back to the electricity. They will lose that property, actually. So that's a Curie point. Now, which one is that from the following options? What do you think? Is it above the 350 Fahrenheit? Is it above the 350 Celsius centigrade? Is it above the 100 Celsius? Is it above the 100 Fahrenheit? Or is it above the 180 Celsius or centigrade? In which heat the crystal will lose their property? Yes, B is the correct answer. Yeah, above the 350 Celsius. If we put transducer or crystal or that active element in a heat above that 350 Celsius, then after that, it's just a stone. You will not have that property to convert electricity to the sound and sound to the electricity. Absolutely correct. Let's do the next one. Okay, now choose the correct option for average soft tissue impedance. Okay, impedance resistance, because sound also have some kind of, there is a resistance in front of the sound, which they cannot go. So against the sound is resistance. Now, what is the normal, our average, we can say, impedance for the soft tissue? Is it 400 rails? Is it 40,000 rails? Is it 1,630,000 rails? Is it a very long number? 4 million rails? Is it 1630 rails? Which one is the correct one? Yes, C is the correct answer. It is, we can say, 1.63 mega rails. That will be the short way to say that. C is the correct answer. Okay, let's do the next question. Okay, it says transducer crystal is solid. Yes, we understand that. And its impedance is approximately how much times greater than the soft tissue of the body, of a human body? Like how much times greater? Like how many times? Is it 2 times greater than human body impedance? Or we can say, yeah, or 10 times, 12 times, 20 times, or 100 times. Like how many? Because human body soft tissue is not a solid something, but crystal is a solid. The impedance in crystal is for sure greater than the human body soft tissue. But how many times? Yes, D is the correct answer. 20 times it's greater than the soft tissue of the human body. Correct. Let's do the next one. Okay, so the next question is, choose the correct order of impedance or resistance from the higher to the lower. Okay, it's in order. Which of the following is in correct order? Higher, after that little higher, then medium, then low, and then very low. The impedance, put it like from the higher to the lower in order. Is it A, PZT is greater than matching layer is greater than coupling gel is greater than the skin tissue, the impedance we're talking about? Is it matching layer and then PZT, then coupling gel, then the skin tissue? Is it coupling gel, then the matching layer, then the skin tissue, then the PZT, or is it the skin tissue greater than coupling gel, then the matching layer, then the PZT, or none of the above? The question is asking for the impedance, which one have the highest, then after that, and go to the lower. So from high to lower, what is the correct order? Yes, A is the correct answer. First of all, we have the higher impedance or resistance and the PZT for the sound. That's a solid, correct? And then after that is the matching layer. After that is the coupling gel. And after that will be the human body tissue, soft tissue, correct? Okay, next. Which of the following transducer will provide you with better image quality of prostate in a patient of 65 years old? What do you think? A patient came to you and he is 65 years old. You want to scan the prostate in this man. So what do you think? Which of the following probe will give you better image quality? Like the best image quality? Is it a linear switch array transducer? Is it mechanical probe? Is it convex phase array transducer? Is it a linear phased array transducer? Is it curvilinear array probe or convex probe? What do you think? Which one will give you the best image quality among them? Yes, of course. It will be convex phase array transducer because it's a transrectal probe. It will go very close to the prostate, and then it will be less distance between the probe and the prostate. So you will have a high frequency transducer with a lot better axial resolution because they will produce a shorter SPL and the image quality will be the best. Correct. Let's do the next question. Okay, it says, which of the following is the part of ultrasound beam anatomy? Like we have anatomy of the transducer, and then we have the beam anatomy as well. So which of the following is the part of the beam anatomy? Is it near zone, far zone, focal zone, focus, or all of the above? What do you think? Which one is the part of the beam anatomy? Exactly. All of the above is the correct answer because focus is also in the beam. Focal zone is also in the beam, far zone is also in the beam, and near zone is also part of the sound beam. Exactly. That's an imaginary hourglass shape, correct. Next question. Okay, if the transducers, if the diameter of the transducer is 4 millimeter, calculate the diameter of the beam at the near zone length 2 and ZL2. So what will be the correct option from the following? If your transducer, the diameter is actually 4 millimeter. What do you think? In ZL2. Exactly correct. A is the correct answer because if you remember from ultrasound physics, we have formula for the diameter of the beam. To look for the beam diameter, we need transducers the diameter. So we said that for NZL1, if you want to look at for NZL1, we said that beam diameter at NZL1 is equal to half of the diameter of the transducer. And then the second formula is, we said beam diameter in NZL2 is equal to exactly the diameter of the transducer. So here the diameter of the transducer is 4 millimeter. And then in ZL2, it will be also the same. Now, each time you increase half in half, like for the NZL3, it will be 2.5. And then for the NZL 4, it will be half more. So that will be like 3 times greater than the transducer. So that is correct. For that, A is the correct answer. Let's do the last question. Not the last. For today, it's the last, of course. Okay. If the diameter of the transducer is 2 millimeter, calculate the diameter of the beam at a near zone length 4. So we had that for NZL2. Like I said earlier, each time you go for the next NZL, so you have to go for that near zone length. Each time you increase half of that beam diameter. So here we look. If you have a 2 millimeter diameter of transducer, so in NZL1, it will be 1 because it's a half. In NZL2, it will be equal. It will be 2 millimeter. In NZL3, it will be 3 millimeter because 2 and then plus half of that. So that is 3 millimeter. Now, in NZL4, they're asking for NZL4, correct? So it will be 2 times, like 2 times of the diameter of the transducer. So that will be 4, we can say 2 times 2 is 4 millimeter, and that will be the B will be the correct answer. Correct? For NZL 5, it will be 2 times and half. And for NZL 6, it will be 3 times of the transducer. So that's how is the formula. Thanks a lot, my dear healthcare providers. Once again, please don't forget to share the channel with your all other colleagues, those who really in this field, or they want to sit for the ARDMS examination, or maybe they have a training center, so they are the trainers and the sonography and the radiology, and they teach ultrasound or sonography. So please let them also know if this could help them a lot for the knowledge, or also for any national or international examinations, to subscribe the channel for the upcoming notifications. Take care and see you guys later.